Hello and welcome. Welcome to my channel OSCE with Bimel. ഇന്നത്തെ നമ്മുടെ ടോപ്പിക് ഓഫ് ഡിസ്കഷൻ UK NMCയുടെ CBT സെനാരിയോയ്ക്കകത്തുള്ള അതായത് കമ്പ്യൂട്ടർ ബേസ്ഡ് ടെസ്റ്റിൻ്റെ സെനാരിയോയ്ക്കകത്തുള്ള സെൽഫ് അഡ്മിനിസ്ട്രേഷൻ ഓഫ് മെഡിസിൻസ് ബൈ പേഷ്യൻസ് പേരൻസ് ഓർ കെയറേഴ്സ്. അതായത് പേരൻസിനോ കെയറേഴ്സിനോ if they want to go for self-administration, that is possible in UK scenario, that should be there, that has to be initiated. So it is the responsibility of the primary nurse and the nurse manager to look into that if the patient is looking for or the family is looking for self-administration of the medicine. Today in this scenario, we will see what's going to happen in case of a self-administration of medicine in case of a UK scenario. So there are, suppose a patient or a family member or a parent is looking for or a carer is looking for self-administration of medicine. Now your job is you have to assess the feasibility for self-administration. Is it okay to go for self-administration? That has to be assessed. So in which the primary nurse will be doing an assessment in which she will be finding out into 3 levels. Okay, plus 1, there is one more level will be there. So it's called 3 plus 1, that's called 4 levels are there. We will see what's going to happen in case of level 1, level 2, level 3, and there is a shared level that's called level 2 and 3. Okay, so that's the fourth one. You will see one by one what's going to happen in each levels. In level 1, this is a dependent administration. So what's going to happen is during the medication round, the nurse will be reaching the patient's room or patient's side with her medicines. Okay, now what she have to do is she have to take out the medicines from the medicine press and give it to the patient, and the patient will be taking the medicines in front of the patient, in front of the nurse. So this is what is called the level 1 administration. That means the nurse is giving the medicine and the patient is taking the medicine by himself in front of the nurse. That's called a supervised administration. Okay, next one is level 2, that's called a shared administration. What's going to happen is the medicine is kept in the patient's room, but the key is with the nurse. Okay, medicine is kept in the patient's room and the key is with the nurse. When the medication round happens, the nurse will reach over there and open the press. Okay, now what happens is the patient is going to take the medicine by himself, and patient is going to take the medicine. That means the patient is going to swallow the medicine in front of the nurse. That's called level 2 administration. And in case of level 3 administration, what's going to happen is this is purely independent administration, where the patient is having the medicine in his room and the key is also with him. Okay, so what's going to happen is then the timing is also given to the patient. This can be applicable with a tablet or syrup, or sometimes a local administration of creams, some kind of ointments and stuff like that. So the key is also with the patient. So what's going to happen is when the medication administration time happens, this is already described with the patient. Patient is taking the medicine by himself and the patient is swallowing the medicine, or patient is administering the local cream or something is there. So this is what's called independent administration. There is no supervision that's going on there, and this is the nurse is relying on patient's response. That means if the patient is talking to the nurse, okay, I have taken the medicine, then the patient's in the mark sheet it's recorded as self-administered, or yes, there is a code will be there. Okay, then the next one is the fourth one is called a level 2 and level 3 administration. That's a partial administration. I will tell you the example for level 2 and level 3 administration, the combination of 2 levels. So what's going to happen is a patient who is a diabetic patient who is recently admitted in the hospital, and patient is on a diabetic medicine, and the patient is taking this diabetic medicine by himself for such a long time, and she want to keep that independence by herself. So we will keep the diabetic medicine by level 3. That means totally independent. The key is also given to the patient, and also the medicine is in the patient's room in the press. So the patient know the timing, and when the time approaches, patient is going to take the tablet and he is going to swallow the tablet. Okay, and the other one, patient is started with a new antibiotic there. So the antibiotic is also kept in the patient's room, but the key is with the nurse. So when the medication rounds happens, nurse will reach over there, and the nurse is going to take open the press with the key, and the nurse and the patient is going to take the tablet by in front of the nurse. So this is going to happen in case of the level 2 and level 3 administration. So here the antibiotic is level 2 and the anti-diabetic medicines are level 3. So this is what that is happening in case of the self-administration of medicine. So if any patient who is looking for self-administration in the UK scenario, that patient has to be assessed for feasibility of self-administration, and that has to be addressed by the nurse. Okay, so I hope you got an idea about the self-administration of medicines in UK scenario. So I will come back with another wonderful video in the next class. So thank you very much for listening to this video, and if you like the video, please click the like button, and also please share this for your friends, and also please subscribe for my channel. Thank you very much.